and thanks for joining us. I'm very happy to be introducing you to Mary as our guest speaker. Mary started her nursing practice in 1973 from the University of Toronto. She then moved on to get her master's and her PhD. Mary's practiced professionally as an RN since 2001 in palliative care and has had to practice self-care in her personal life. She also co-directed the Contemplative End of Life Care Practice Group. For many years, Mary has been a student of mindfulness practice at the deathbed, exploring its benefits for the dying person, their loved ones, and their caregivers. The Palliative Care Society of the Bow Valley is really excited to have Mary here as a speaker, to share her experiences with us, guide us through the challenges of caring for ourselves when most of our time is taking care of someone else. Mary, please take it away.
Thank you very much, Cathy. Hello, everybody. It's lovely to be here. I welcome you very warmly, whoever you are and wherever you are. And under normal circumstances, we would go around the room and I would find out what you're bringing to the session today in the way of both concerns and practices that you're already doing related to self-care. The other thing I want to say is that I imagine for many of you, the burdens of caring for others and self-care are a little more amplified in this time of the COVID-19 epidemic. And my talk was prepared before all this happened, but I do keep in mind that some of the challenges are a little more extraordinary right now. And if you want to come online and divert the conversation a little bit to how do we cope now as the presentation proceeds, I'm perfectly happy with that. I have a PowerPoint all set to present, but I do welcome your comments. I think this kind of topic lends itself to a conversation rather than more didactic information. I have, as Cathy pointed out, looked at the issue of self-care for many, many years. And to distill the presentation into two parts, what I discovered over the years was that there are two aspects to self-care, which I'm going to be talking about. The first one is what you do for yourself, the things we do, the instrumental things. We'll be spending a bit of time on that, how we structure our conversations with the people that we're helping, how we look after ourselves in more sort of formal, conscious ways. The second aspect of self-care, which I feel is even more important, is how we think about what we do and who we are as caregivers and how we regard self-care. So it's what we do and how we think. And I'm going to be addressing both of these today in the session. One of the first hurdles that I struggled with as a caregiver trying to care for myself as well was this notion that many of us carry that taking care of ourselves is selfish. And Catherine, I need to advance the slide here. There we go. I don't know what I just did, but I did move on to the first slide. This is a concern that many of us have, even if we're not consciously aware of it. We tend to put ourselves second and to forget that the quality of the care that we take of other people has a lot to do with the quality of the care that we take of ourselves. Some of you may have read the very, very brief allusion that I made in the little blurb that went round advertising this session in reference to Mother Teresa. There was a documentary that was made by Mother Teresa, about Mother Teresa many years ago now, and it was noted by the people making the documentary that her nuns were particularly well fed. They had nuns devoted to the kitchen and to making sure that everybody got 3 square meals a day, not gourmet food, but certainly adequate and nourishing. And because many people assume that nuns lead a very ascetic life, a very sparing and frugal life, she was asked about this. And she said, well, if my nuns aren't well nourished, they can't do God's work. And that was a very memorable statement for me to hear, because it reminded me of how the care that we take of ourselves has everything to do with how well equipped we are to care for other people. So in a sense, it's really the opposite of selfishness. It's allowing us to give from a place of wellness, as the slide says, we give more and better, and we're not distracted by our own needs. And this comes down to very simple things such as, are you comfortable in the chair that you're sitting in when you're talking to somebody that you're visiting? And if you're not, you're distracted. You're aware of yourself too much, and it takes away from your ability to focus on the other person. So how important is it to, as part of your self-care, find a comfortable seat, or take an Advil before you go, or have your lunch or a glass of water, or make sure that you're not in a position where you're distracted by your own very human, ordinary needs and wants. The other way to look at it is that you are no more or less important than the patient or the person that you're caring for. Everybody is in need of care, and that happens to include you. So it's important as we give to other people to allow the world to give to us as well. I have a slide here that shows this is a refuge or a hospice or a hostel on the pilgrimage route to the Shrine of St. James in Spain, in Santiago de Compostela. Some of you may have heard of this pilgrimage route. It is closed for this year, but it's been running since the Middle Ages. I've traveled this route many times and taken many pictures. And this is a picture of a monastery where pilgrims on their way to Compostela to perform their pilgrimage would stay, and they would be cared for, housed and fed, and looked after if they were sick or injured by the monks and nuns who were in this monastery. They were often at the end of their lives. People were not well often when they went to Santiago, and they were suffering and dying and never made the full journey. So there are usually big burial grounds out behind these places, because there was a lot of end-of-life care that was given in these hostels as well. But the reason I want to show this slide is that what's implicit in the relationship between the caregiver, the monks and the nuns, and the pilgrims is that everybody's on the same road. In a sense, everybody's a pilgrim. And so as much as the pilgrims benefited from the care that the monks and nuns provided to them, similarly, it was just naturally assumed, it was part of the bargain, that the caregivers received. They received an opportunity to grow spiritually. They received an opportunity to fulfill their vocation, to help out. Everybody benefited, and this was implicit in the caregiving. You could call it the model of the time. Over time, over the centuries after the Middle Ages, that view kind of eroded, so that it was all about the patient and it's not about me. And I'm not supposed to get anything out of this. The focus is completely on the person I'm working with, to the detriment of the caregiver. And that's why we have concerns now with self-care, is that this has been so neglected over the years. But the original model of caregiving was that everybody benefited from the act of giving care. There's another barrier to self-care, and that is believing that we're stronger than we really are. We have this idea of ourselves that we're made of iron, and many of us take on many more things than we probably should. But it's important as the beginning of self-care to respect the fragile parts of your own being. These are not weaknesses, they're just how we come into the world. Human beings are vulnerable in a physical way, in a spiritual way, in an emotional way. And if each of us has unique areas that need recognition and some caregiving. Those of us who are a little bit older are more than aware of this. I notice how tired I can become. I didn't used to be. 15 years ago, I could barrel through a day and never thought a thing about it. Now I barrel through a day and it takes me another day to get over that barreling. Some of you may be in a similar position, and there's nothing unusual or terrible about that. It's just a fact. I need more sleep. I need more rest because there is this area of vulnerability in me. So I'd like you to just think for a couple of moments about your own fragile areas that may need a little bit of extra care. And these may be physical. Maybe you have a health problem that requires medication or extra sleep or a certain kind of food or longer rest periods between activities. Maybe you have an emotional struggle, quick to anger, overly invested in people so that you lose a lot of sleep with sadness or distress. Not weaknesses, just features of who you are that need a little more holding and a little more care. So I'll ask you just for 15 or 20 seconds to think for yourself. We're not going to discuss it, but to think about for yourselves, where are my areas that I probably need to pay a little more attention to in order to be able to give to the extent that I am able. There are a couple of conceptual pieces I'd like to deal with in the next 3 slides. And the first one has to do with something that, this is a name I've given to it, is micro tears or micro tears. You can interpret that either way you want, from a physical or an emotional perspective. But micro tears, the idea came to me actually when I was on the road to Santiago in Spain. And the first time I walked it, I was doing probably 25 to 30 kilometers a day with a backpack on my back on fairly rough terrain. And I did great for the first 10 or 15 days, and then my legs fell apart. And what I had not realized was that every day, even though I didn't recognize, took a toll on my muscles until, as you can see on the slide, I had sudden onset misery that set me back many days on the trail. And I needed help from other people to get through the rest of the trip because my legs were not good. I had shin splints. When I repeated the trek some years later, I took walking sticks and I took 200 milligrams of ibuprofen every night after every walk, whether I needed it or not. And that was in recognition of the fact that even the things that you feel may not affect you all that much in your caregiving or in the stresses and strains that you put on yourself, there are micro tears, there are microscopic effects that over time build up. So one of the cardinal rules of self-care is to catch the micro tears before they accumulate and become big problems. So after every session with someone you visit, someone you see, someone you get groceries for, you're sitting by the bedside, you're looking after their kids, whatever it is you're doing in your volunteer work, check in with yourself. How am I after this? And it may be, oh, it's fine, I'm good. But you may discover, if you reflect a little longer, that did kind of get to me a little bit. And it's important to attend to those little bits of effect and look after them. Maybe this is the night for a glass of wine or a hot bath or a walk or whatever. And we'll come to more self-care practices in a few minutes. But the cardinal feature of something that we call compassion fatigue, and in the next slide we'll talk about burnout, is that it may be gradual in its approach, but there can be this terrible collapse that just really disables you from pursuing the thing that you're doing, the care that you're giving. So compassion fatigue is, as you can see in the slide, a lessening of a feeling of empathy or compassion. It can build up over time because you didn't catch the micro tears. The example I have of this is a chaplain that I worked with in the United States. I did some hospice work down there. She was a brilliant chaplain. This was home hospice. She had been a nun herself, was very committed to the work of caring for the dying. And she was very busy, and she was visiting a lot of patients, and you can appreciate that this is fairly draining work if you're seeing 5 or so patients a day who are in some degree of suffering, either physically or emotionally or spiritually. Now, one day she came back to the office at the end of the day, and I happened to be hanging around, and she sat down by my desk and she said, "Mary, I listened to the last 2 patients that I visited, and I just looked at them and I thought, I don't care." And Suzanne was very horrified at this complete bottoming out of a sense of compassion or caring. I just don't want to hear another thing from these people. I want out of here. Suzanne had the good sense to recognize that she had a problem with compassion fatigue. And it was characterized by some of the things that you see on the slide. The sense of dreading what you're about to do, not knowing what you're doing, or feeling as if you don't know what you're doing anymore. And it seems to be related to the hopelessness that you see in others and your personal response to that. So that's the important piece about compassion fatigue. It's how you think about what you're seeing and how you recognize and hold the suffering that's before you. This is to be distinguished from burnout, which has to do, it has very similar characteristics, but it has to do with the pressure that's put on you by the organization that you're working with. or perhaps by your family, or by other factors around that are making demands on you. So it's not so much that your feeling of response to suffering is affected, it's the demands that are coming on you from the outside, in this sense that I just can't keep up. There's just so much to do. I have to make all these phone calls, just overwhelmed with too many things. The reason I point out this distinction is that it's important to ask yourself if you're feeling these signs. I don't care. I'm dreading seeing people. I don't know what I'm doing anymore. Why am I here? I can't get out of bed in the morning. The important question to ask is this something that I myself am bringing to this in with regard to my response to suffering, my own personal response to what I'm seeing? Or is it something out there that's demanding too much of me? And the way you approach both of those is quite different. Often it's both, but we need to distinguish. What do I need to address with my manager or the person who's asking me to see far more people that I can see? Or perhaps the family that's making too many demands on me. How do I handle that versus how do I rework my own response personally to the suffering that I witness? So that's an important question to ask yourself if you're beginning to feel like you're just getting very, very tired and don't want to carry on. Here are some of the other symptoms: fatigue, a sense of cynicism sometimes, inefficiency, can't get stuff done. Depression is often part of this, making mistakes, work performance, annoying your peers, getting angry when you normally wouldn't, and so on. So these are some of the signs to look for, but it is important to ask that question, where's it coming from? I mentioned already the importance of preventing compassion fatigue and burnout by paying attention to what's happening each day. And after each time that I have spent, each moment that I've spent with the people that I've been with, how do I feel after this? Was this a particularly tough visit? Do I maybe need to shorten the next visit or do something different than I planned today to reset the balance from this one? Or maybe it was fine, but the act of checking in is important to ask yourself, how am I doing today? So don't wait till next week or till you've done a month of volunteering, ask it every day. The other piece of this is refraining from taking on too much work. There are certain situations that we can walk into where you can just feel absolutely overwhelmed by the need that presents itself to you. But the universe is going to do a lot of work on this itself. And the important question to ask is, what's given to me to do in this situation? None of our patients or families expect us ever to solve everything. Everybody knows you can't take it away, the pain that you see or the difficulties that people have. Most people know that you're not the person that's going to fix it all. It's the delusion that we give ourselves that I'm going to fix all this. But it's more important to ask, what's the universe going to do for me today? What can I trust will be taken care of? And what can I do to help? And sometimes it can be a very small thing. So I'll give you one example. I'm just going to check the time because we need some time for discussion, but I think we're okay. I had a patient several years ago who had Lou Gehrig's disease, ALS. Most of you have probably been familiar in one way or another with this very difficult disease. And I'll call this patient Karen. Karen had had a motor vehicle accident about 20 years prior to her diagnosis, and she had severe chronic pain from that and was on extraordinary doses of what we used at the time, which was oxycodone and OxyContin, drugs that we don't, at least we don't use OxyContin at all anymore. But she was on very high doses of this drug. And as her disease progressed, it became more and more difficult for her to reposition herself. She was now in a wheelchair. She had the use of one arm from about the forearm down, a little bit of movement there. She could not speak very well because her ALS had affected her ability to speak. She couldn't wipe her nose if she was tearful or had an itch. And she was pretty debilitated. And getting towards the end of her life at this point, I had known her for quite a long time. So we were quite familiar and friendly. But one day I went to see Karen and she was in her wheelchair and she could not get comfortable. Her husband was with her And she was tearful, but she was choking because she couldn't clear her nose because she was having difficulty swallowing. It was difficult for her to speak. I thought she was in pain. We offered her pain medication. No, 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 didn't want that. Do you want to be repositioned in your chair? No, 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 didn't want that. Just kind of shaking her head and moving that one arm. Do you want to go back to bed? No, no, didn't want that. Just everything we tried or offered, the answer was no. And this went on for some time, and you can appreciate that this would be a distressing thing for a caregiver, a nurse like me, to encounter. I couldn't fix anything. And nurses are compulsive fixers, and I was very much in fixing mode, but it wasn't working. And finally, I said to Karen, I looked her right in the eye, and I got down eye to eye level with her. And I said, Karen, I can see how much you're suffering, and I think you want me to leave. And she said, yeah, she could kind of nod her head, and the gesture was, yeah, go, go. She wasn't angry, but she was upset, and she was done with me. So I said to her, I will come back tomorrow morning and see how you're doing. And you can imagine as I left, I didn't feel very good because I had left a patient in a state of severe suffering. When I went back the next morning, I let myself in because I could come and go. I knew them well enough. I walked into the house and down to her room. Her husband was there, and I forget what had happened, what he explained to me, but she was back in bed. She was in a semi-reclining position. She was smiling. She was peaceful. She was in no pain. She looked as serene as could be. I don't know what had happened when I was gone, whether a neighbor had come in later and got her back to bed. I honestly forget what the story was. And when she saw me in the doorway, she reached out with that one hand, and I came over and I took her hand and she gave me a squeeze. And I realized in that moment that my role had been simply to say, I see how much you're suffering. It was simply to state what was true and let her know that I knew what she was going through. So it was a shared thing, that I got it. And I will never forget that encounter with Karen, because it taught me that even in the smallest things, and sometimes even seeming to do nothing, is actually doing something very big. And what it really did, I think, was increase the trust that we had and in each other, really. And also let her know that I really was on her side, in a sense. I could see it from her perspective. And again, she was not expecting me to fix it. She knew that it was not fixable. Karen died a few, it was less than 10 or 15 days later, died in hospital as it turned out. But it was a gigantic lesson to me in looking for the small things that can be done, even when you think that nothing can be done, and not underestimating what is helpful. Letting the universe do the rest of the work for you, trusting that there is another force out there that will help you, that we're not the only game in town. Okay. So I think I'll just pass over this slide, except for the first bullet, the first part of the first bullet. One of the things that we often overlook is, how do we know when things are going well? We know when we're stressed, we know when we're not feeling great, when we're tired and all of that, but we don't pay as much attention to the signs that we are okay, that we are functioning in a helpful way, both to ourselves and others. And I'd like you to just think for a few moments about what it feels like when the going is good, when you're secure, not hungry, feeling good, things are going well. What does that feel like? I'll give you 15 seconds to just think about that for yourselves. You can write them down if you like. It's important to think about this. Okay, because the question is, how do I cultivate these states? What can I do to amplify how this feeling recognizing that there are times when you won't be feeling this way, but often we overlook it instead of resting in those moments where things are good and asking, okay, how can I just stay here for a little bit longer and become familiar with this and create pathways to get back here when things aren't so good? What does it feel like to be okay? This is an important question. And some of the ways to cultivate our sense of well-being is simply to look after ourselves the way we've been told many times over the last few weeks. Stay well physically, eat your breakfast and lunch, get a good sleep the night before and the night after your volunteer day, and plan a way to reset the balance. Oh, my slideshow did come up properly. I rejigged it. I had just go to a good movie, but we can't do that anymore. So we can reset the balance sometimes with a good movie on Netflix these days, or a relaxing evening with friends 6 feet away, or a long walk by ourselves. Talking or writing about your feelings, if that is something that is helpful for you. Not everybody's a talker or a writer. Sometimes there are other ways to process what has happened to you during the day and what's going to help you return back to that state of well-being and feeling nourished and able to manage things. Also, it may just be that I need to take a break. It may be for an hour, it may be for an afternoon, it may be for a week or even a month. So it's important to ask ourselves, what do I need? And maybe it's just to not do this for a while. Okay, I'm going to pass over this. In the longer version of this, we talk about stress management. There are a dime a dozen, especially nowadays. There's all kinds of material out there on coping with stress related to COVID-19, but there's a lot of stuff about self-care as well. The second bullet is of interest, though, because there may be some ways that you would like to explore for managing the challenges of being a caregiver. And you might just want to write some of these down. In some of the other sessions, people have said, I've never done meditation before. I'd like to give it a whirl. Other people have said, I don't go for enough walks. I'd like to try that. Or maybe I should have more baths. Or try yoga. Tai Chi was something that a lot of people have mentioned. One of the other ways is to join a group where, like for caregiver support, very good way, maybe something that would be new to you. We'll come back to some of these strategies a little bit later, but there may be things that you're thinking, gee, it might be helpful for me if I joined a book club that read books about thoughtful subjects like self-care or philosophy or history or something that expands my view of myself and the world around me and helps me relax into what I do and who I am. Here are a few practical tips for avoiding stress and inner turmoil during the time that you spend with patients and with families or the people that you're volunteering with, the people you're supporting. I mentioned already a few minutes ago about assuming a relaxed physical position, making sure that you're physically comfortable. And I've even asked people, when I go in, I do a lot of home visits. And if I end up in a chair where my back is complaining, I will say to people, would you mind if I just moved over to that couch where I don't have to, where I can see you a little better? I don't make a big deal about my back, but I will try and find a way where I'm as physically comfortable as possible. Another skill is learning to slow down. We have a job, we have a mission, we have a purpose of being there, and we want to get stuff done. That's our general, we have an agenda, and it's our general outlook to try and get as much as you possibly can accomplished in the time you're given. And sometimes the agenda takes a turn that you didn't expect. And sometimes your agenda isn't important at all. So it's when you walk in the door or you sit down with somebody, it's important to put the agenda aside and just take your time to see which way the wind is blowing in the room where you are at the moment. And just slow it down. Do I really have to do all the things that are on my mind to do? let's just find out what's going on and where I can be useful. I have a short film to show you where this becomes very clear how this can be done. Oftentimes in our conversations with people, we can use silence to relax and just let go for a little while. Silence is often an alarming situation because it seems as if everybody's run out of something to say. But my guess is that in many of the interactions that you have with the people that you visit, you may be discussing things that are seriously important and require some reflection. And so often people will fall into silence in a conversation because we all need time to process what's been said. And if we're busily trying to find something to fill that verbal space, we're not giving either ourselves or the other person enough space to just kind of mull things over and process emotionally what's been said. So silence is a huge gift. And often people will start talking on their own. If you just stay quiet for a while, it may feel a little uncomfortable until you're used to it. But conversations have a way of unfolding on their own rhythm. And we often interrupt that rhythm because we're eager to fill up the space that makes us uncomfortable. But in many of the situations that you're involved in and that I've been involved in, the silence is very important as part of the conversation. So we mustn't attenuate it. But it also gives us a chance to sit back, take a few breaths, just let go of things, stare into space for a few minutes. We can be satisfied with small gestures. The example I gave you earlier, working with Karen, was one of them. Just acknowledging what's true in this moment. There's suffering. But sometimes it's a question of getting somebody a cup of coffee or holding a hand or just something tiny. These small gestures have more of an effect than you probably think. And so it's important to trust that whatever we do is important. The other piece of this, though, is knowing when to leave. The patients, many of the people that I visit, and I'm sure it's true for you as volunteers as well, they don't feel good. They are ill, or they tire easily, or they've got other people that they want to see, or they need to sleep, or whatever. And after a certain point, they're done with you. Your time's up. And we don't want to outstay our welcome. By the same token, maybe we've already ourselves had a busy day or a stressful day, and we're starting to feel weary and a bit worn out. It's time to leave. There's no harm in just cutting the visit a little bit short so that everybody ends on a sense of, oh, that was great, as opposed to, oh, thank God they're gone, or thank heavens that's over. So sometimes less is more. And knowing when to leave is an important feature of these visits in terms of both respecting the stress that conversation can impose on the people we visit and the impact that it has on us too. After the patient encounter, we can ask, and this is looking at micro tears and micro tears again, what happened to me in this encounter? It's important just to pause and ask the question. You may not get much of an answer, but asking the question is the important part. How do I feel after leaving this person? What did I learn about this person, or about life, or about myself? Notice that this is not, how did I do? Was I a great volunteer? Did I do a really sterling visit? Did I get a lot done? It's not about evaluating. It's about, what are my feelings about this? What do I know now that I didn't know before? So it's a very gentle question. It's not about evaluating ourselves. It's just an inquiry. Many of us see a lot of suffering, and in particular now, the suffering that arises with COVID-19. Where do I put that suffering? What do I do with it? Is it going to gnaw away at me? Or do I have some means of absorbing it in a way that it becomes part of my worldview, where there's a container for it? Where do I put it? When we start being tormented by the suffering that we see, we need to ask that question. There's a lot of suffering that I'm reacting to. How do I, as a person, respond to suffering? We're going to come more to this in a couple of minutes when we look at the more contemplative aspects of self-care. One of the things I want to just draw attention to first is avoiding the drama in the language that you use to talk about the situations that you've been in. Sometimes we use language that escalates the emotions as opposed to language that simply describes a situation. So when you hear yourself using extravagant language, such as, oh, you won't believe what I saw today, it was the most horrendous thing, da, 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 da. If you hear yourself talking like that, ask yourself, am I escalating my own emotions, or am I beginning to, is it helping me find a place of rest? And if it's not, in talking about what has happened, if it's not helping you find a place of rest, you may be using the wrong language to describe it. Is it too explosive language? Similarly, if you're talking to other people about what you've encountered, and they get into it, oh my God, don't tell me. Yeah, let me tell you about what happened to me. The two of you get so escalated that you both come away exhausted, and you've completely subverted the attempt to come to a place of rest with what you've seen. You can see from my example earlier with Karen that at first I wanted to rescue her from her suffering and make it all go away and take away her pain and make her comfortable. That was my mission, and that's why I struggled so much. So when I could come to bearing witness and sitting with and just recognizing this is the reality and I don't have a role here beyond recognizing that, that was often what I needed to do. So let's not get too focused on problem solving if there are no problems that you can solve, and shift into bearing witness. I see what's happening to you today. I can see this is tough. How be I come back tomorrow? How be I give you a call tomorrow? Is there anything you'd like me to do between now and the next time I see you? That kind of thing. But not having to fix everything, because this all gets very dramatic and we put a lot of pressure on ourselves to do these things. So the third barrier to self-care now turns us to this other aspect of self-care that I was referring to, and that is cultivating how we think about ourselves as caregivers. This is it's a problem when we don't have a way of building tolerance and resiliency for difficult situations. This isn't about stress management, a glass of wine and a hot bath with bubbles and a massage. These are things that are wonderful to do. I do them. I hope some of you do as well. But this is a more proactive approach that looks at the bigger picture of why am I doing this in the first place? What is my sense of compassion? Where do I want to cultivate? Where can I cultivate wisdom in what I'm doing? So it's a kind of an inner transformation that occurs. You can't do it in the moment of caring for somebody. It needs to be something that's cultivated apart from your caregiving, so that you can move to that refuge when you need it. It's a bit like childbirth education. You don't start teaching someone who's about to give birth about how to do breathing, the correct breathing, when they're already in labor. It's months before where you start teaching people how to breathe during birth, so that when the time comes, they have a pathway to relaxing that's already ingrained in them, that they've already learned. And it's the same thing here. That spiritual self-care, it can take place at the bedside, but the ramparts of it, the ballast that you have for it, is something that it takes place apart from the bedside. And it's this practice of creating a safe harbor for yourself, so that in times of difficulty, you know where to go. You know, there's a lot of suffering. I know where I can go with this. We have every spiritual tradition on the planet has the foundation of this. So no matter what your faith base is, Christian, Jewish, Islamic, Muslim, Buddhist, any of them, I've missed one, I can't think what it is, but if you have a faith tradition, there will be resources there for you. If you don't, there's plenty of stuff that is a-religious, that is profoundly spiritual and can take you pretty much in the same direction. We must always make sure that whatever spiritual approach we're taking and bringing forward in the work that we do suits us temperamentally, suits our beliefs, that we're profoundly comfortable with it. You can't sort of adopt a faith tradition that you're a bit squirmy about and it's expected to help you. So I have two examples here on the left of the slide, my left. This is Jesus raising Lazarus from the dead. Christ is recognized in the Christian tradition as the great physician. And from that stems a whole discourse about self-care, about helping others, about compassion as the root of our interaction with people who are suffering. And it's exemplified in the great iconic figure of Christ as the physician. And in the Buddhist model, I'm just using these two as fairly familiar traditions to me. The Buddhist model similarly is founded on a sense of the recognition of suffering and the response to it. And the Four Noble Truths of Buddhism are all about a pathway to being able to contain suffering and address it fearlessly and directly. And so there are various Buddhist practices, contemplative practices, as there are in Christianity, as there are in Islam and Judaism, that enable us to practice finding those spiritual foundations and building them for ourselves. This isn't, in the big sense, not everybody's a monk or a nun, as the slide says, but there is something of the monk or the nun in everyone, and that should be cultivated. I don't know who said this. It was a great sentence that I read in a magazine somewhere many years ago, so I don't have a reference for it, but I think it's a very, very helpful comment, because it's true that not everybody has a contemplative bent, but this sentence indicates that there is a contemplative streak in everybody. Some people have a large streak, other people very tiny, but it's there. And whatever is there for you in terms of spiritual practice should be cultivated. So these are meditative practices to build resilience and compassion. A few guidelines for how to pursue this if this is something that's completely new to you. This should not be an expensive endeavor. You shouldn't have to buy new clothes for it. It's nothing like that. It must be manageable from a time perspective and suit you temperamentally. You may want to find a spiritual community to support you. And you need to ask the critical question, is this practice taking me where I need to go? Is this helpful for me? Does this transform? Does this make me feel more comfortable in myself as a caregiver? Does it enable me to contain the suffering that I see? If it doesn't, then you find another one. Now, I want to show you a film, and I know the time is just a little bit tight, so I think I'll just pass over this slide. I'd really like you to see this this short film, and then we'll have a very few minutes for discussion. But I think Frank Ostaszewski is one of the pioneers in the contemplative end-of-life tradition. He's very well known. You can Google him. He's all over the place. It's very easy to find him on the web. But this is one film about caregiving that I really like. And I want to just, there he is. I want you to see this. There he is. Okay, self-explanatory. See what you think about this. Frank was, he's a psychologist. He was the founder of the Zen Hospice in San Francisco in the 80s at the height of the AIDS epidemic. But he has worked since then in end-of-life care. So
I think one of the things that's important for us as caregivers is to learn how to find a place of rest in the middle of things. Some years ago, I was taking care of a patient, a very rough, tough, 86-year-old Russian Jewish lady, tough as nails, you know. And we became very close friends, actually. And on the night that she was dying, they called me, and I came into the hospice to be with her. And she was sitting on the edge of the bed with her feet dangling off the edge of the bed in her dressing gown, breathing with great difficulty, you know. She was clearly actively dying. And so I came in the room, and I sat down in the corner on the couch. That's my habit, to sit down in the corner and see if anything's really needed before we jump in to help, you know. And there was a very wonderful home health aide sitting with her on the bed, wonderful woman. And at one point she turned to Adele, this Russian Jewish lady that I described a moment ago. And she said to Adele, "You know, Adele, you don't have to be frightened. We're right here with you." And Adele, tough as nails, turned to her and said, "Honey, if this was happening to you, you'd be frightened." And so I thought, wow. I stayed in the corner, you know. And then a little while later, this very brave home health aide said to Adele, "You look a little cold. Would you like a blanket around your shoulders?" And Adele turned back to her and again, tough as nails, said, "Of course I'm cold. I'm almost dead." So I sat in the corner and watched this whole exchange between them. And I noticed two things in the exchange. The first was that Adele wanted honesty. She wanted someone who's authentic with her. She didn't want to talk about tunnels of light or bardos or near-death experiences. She wanted straight talk. And the second thing was that there was a struggle. There's often a struggle in dying. There's a labor to die, just like there's a labor to getting born. And in this case, the labor or the struggle was showing up in the breath. She was in the midst of chain-stop breathing. So we made all the proper interventions of morphine and oxygen and all the correct, she was well cared for. But I could see that there was something else going on. There was a kind of suffering there. So I pulled my chair up very close to her and I sat just opposite her. And I said, "Adele, would you like to suffer a little less?" And she said, "Yeah." And I said, "Okay, I noticed something." I said, "Just there at the end of your exhale, right there at the very end of your exhale, there was this gap. Just this little pause. And I wonder what it would be like if you could put your attention there for just a moment, just in that gap. I'll do it with you." Now, I didn't guide her, or I didn't try and get her to breathe in any particular way. I just breathed with her. And what I noticed was that her attention seemed to really drop into this pause, into this gap at the end of the exhale. And as it did, I could see the fear in her face just wash away. After a little while, she laid back on her pillow and she died very peacefully. I think Adele found the place of rest in the middle of things. Do you see? None of the conditions had changed. She was still dying. Her breathing was still erratic. She was still cold. None of those conditions had changed, and there wasn't really anything else we could do to manage those conditions. But we could be with her in a different way. And we.
Okay, I'm just going to cut it short there because I want to just, there's only a couple seconds left. I wanted to point out to you the cardinal, to me, the cardinal point of this film, and that is Frank talks about helping Adele find the place of rest in the middle of things, that calmness in the middle of difficulty. But he was able to do that because he could do that. That's the key. And did you notice how he sat in the corner and just watched what was going on until he found his cue? He found the thing where he could be helpful. He let the home care aide do what she could do. He just observed for quite a long time. But he was at rest in himself as he was doing that. And then when his opportunity came to help Adele, he could take her to the place of rest where he already was. So you see, there was no strain there. There was a lovely continuity between where Frank was in himself at peace and what he was able to help Adele with as she was dying. Now, we're not always in such dramatic situations as that at the bedside of a dying person, but it illustrates very beautifully for me how caring for ourselves and finding our own spiritual place of rest enables us to help other people find theirs. And the other piece that I wanted to mention is how he takes his time. There's no rush in any of what he's doing. I had one last screen, but I think what I'd like to do is just leave it like this where I can see you all. One last slide with a phone number and an email address for more information. But we have very few more minutes. I just wonder if there are any questions or comments after this sort of summary video that I've shown you that really kind of summarizes everything I've been attempting to convey today. Any